Here on SA Today. As we continue to commemorate International Nurses Day, we're joined now via Skype from Zimbabwe by Dr. James Avoka Asamani, who is a technical officer at the WHO Regional Office for Africa. Very good afternoon to you, sir, and thank you so very much for joining us here on SABC News.
Yeah, good afternoon, and thank you for having me. Good afternoon to your cherished viewers.
Now, the organization that you represent, the WHO, has been giving us very regular briefings from Geneva regarding, the plight of some of the medical staff all over the world. I'd like us to zoom in on Africa. If you can just give us your perspective of how we're, giving nurses the tools that they need to work at this very dangerous time in their professions.
Okay, thank you very much. First of all, let me take this opportunity to reiterate the statement released by the Regional Director for WHO in Africa, Dr. Matshidiso Moeti, in which she actually paid glowing tribute to nurses for their incredible contribution to the gains we have made in Africa in terms of improving health. We understand that oftentimes you go to deprived communities and hard-to-reach areas where nurses tend to be the only frontline health workers providing services, and we need to commend them for their hard work. Now, more specifically to the area of responding to the pandemic and having tools to work with, we recognize that most countries, if not all countries, were not adequately prepared for the pandemic, and therefore there will definitely be challenges in terms of the necessary logistics and equipment. And nurses are more at the receiving end of this challenge. So we've seen the nurses having to face a shortage of personal protective equipment and other logistics that they need to be able to provide care adequately during the COVID-19 pandemic. And this has sadly led to many nurses, including other health workers, getting infected with COVID-19, and some have even lost their lives. And at this moment, I think our hearts and thoughts are with the loved ones and family members of those who have unfortunately lost their lives.
Yeah, while I was listening to the WHO briefing regarding, the situation in Africa, you mentioned Dr. Matshidiso Moeti, and one of the things that they were talking about was that Africa has actually done quite well considering where internationally it was thought Africa would be when it comes to COVID-19 challenges and the numbers. What are your thoughts on that? Is this a time for us to say that the continent has indeed done well in terms of COVID-19, and could there be more that we could have done? For example, the World Health Organization based here in Africa that you represent, do you feel that you're receiving the right kind of support, or is there more that could be done to assist you yourselves in the work that you're doing for the African continent?
Okay, thank you. I think, like I said earlier, no country probably was adequately prepared, but I think African countries, on the balance of things, they have reacted quite timely in putting in a number of public health interventions to curb COVID-19. And WHO is playing its role in providing countries with the necessary technical support that they need to be able to respond to this. And it is always the work of WHO to work with partners, and in that regard, we are very much open to working with partners to better support countries to deal with the situation. But like I said, on this day, we take the opportunity to really, really thank our nurses for the work that they are doing.
Yeah, we know that nursing, I just earlier spoke to a retired nurse, and one of the things that we spoke about was the fact that, nursing is a thankless sort of profession, just over the years, not just now as we're dealing with COVID-19. Do you think that a day like today, where we are commemorating and celebrating International Nurses Day, that it is important, that it makes some kind of a difference for nurses, or is it really just the same old, same old?
Okay, thank you very much. If you have seen somebody who has received the healing and comforting hand of the nurse, they always remain grateful to the nurse. And for us in WHO, this year, the World Health Assembly designated as the International Year of the Nurse and Midwife to recognize, celebrate, and highlight the important role of nurses globally. So for a day like this, to dedicate it to discuss the work of nurses and to pat on their back that you have done well, I think it goes a long way to comfort them, and it goes a long way to recognize their role, and then to say that, look, you've been the unsung heroes for a long time. It's time to recognize what you're doing.
Yeah. What lessons do you think we'll sort of take from this period that we're dealing with a pandemic, with COVID-19, to ease in terms of the conditions of nurses? I mean, what's happened now is that COVID-19 has highlighted the problems that nurses are faced with. And I just wonder if we will take some lessons from what we see and what's been highlighted as we move forward, hopefully soon, from this disease, virus.
Okay, so there are a number of lessons we can learn, and one of it, I believe, is that Africa generally, even though we share a large burden of the diseases in the world, we have perhaps the smallest proportion of nurses in the world. And we've seen many nurses getting sick, and some unfortunately have died, like I said earlier. Yeah. And all of these go to hurt the system capacity to respond to COVID-19 and similar conditions. So the lesson here is that we need to invest heavily in the production, recruitment, and the working condition of nurses, so that nurses would have adequate nurses to deal with not only COVID-19, but the emerging population health needs of Africa. And this is what the regional director for Afro aptly, underscored in her statement as well.
All right, Doctor, thank you so very much for speaking to us, Dr. James Avoka Asamani, who's a technical officer for the World Health Organization Regional Office for Africa. We thank you so very much for giving us your time, coming to us from Zimbabwe there. Thank you.
Thank you. It's my pleasure. And remember to say, nurses save lives.
I remember that all the time. Thank you so very much, Doctor. All right, let's take a short break. Do stay with us. Your business news with Colin after this.